Hello, are you a woman suffering from large breasts and you're thinking of getting a breast reduction done, but you have some questions? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore, and here are the 10 most common questions patients ask me before getting a breast reduction. Number 1. Doctor, will this improve my neck pain and back pain? Simple answer is yes. This surgery is done by women mainly who are suffering with very large breasts that are causing neck pain and back pain. To help you understand, typically in the breast reduction, we remove around 500 grams to 1 kilogram from each breast. So think about it, that's 1 to 2 kilos less that is being put on your neck and back every single day. It's like, imagine if I were wearing a dumbbell around my neck of 2 kilos every day. That's what it's like. And all our patients are extremely happy that they no longer have to deal with this neck pain and back pain. Number 2, doctor, what will my cup size be after surgery? Will I go down by 2, 3, 4 cup sizes? This is a little bit more tricky to answer. The reason is, one, most women don't know what their actual cup size is. A lot of these heavy breasted women do not get bras that fit them. So to help you understand, a cup size is a number followed by a letter, 32D for example. The number is the circumference of the chest, and that does not change after any surgery. That is the circumference of the chest below the breast. The letter represents to the size of the breast. So when in cup size, the letter changes, the number doesn't change. Now, a lot of women who have very large breasts, they might need a double D, E, F, G size bras. But these are not available, so they compensate by using a larger band size. So where they might require a 32G, they might be using a 36D. So this is what I mean when I say that women might not be knowing their proper cup size. Secondly, there is no standardization. Different companies have different cup sizes. So this is why I cannot give you an exact cup size what your surgery will be after surgery. But to help you understand, as I said, typically on average we remove around 600 grams from each side. Around 150 to 200 grams is one cup size. So that means around 3 to 4 cup sizes. And it can be even more. It can even be 7 or 8 cup sizes. So we can go down to a size that is suitable for your body. We don't want to make it unnatural and make it flat as well. We want to give you nice shapely breasts that fit your body. Number 3, doctor, what are the scars like after the surgery? We have a more detailed video on this that you can watch, but quickly, the 3 common scars after breast reduction can be a periareolar, where it's just a scar around the nipple, a lollipop scar that is around the nipple plus a vertical scar running down, and an anchor that is horizontal, circle around the nipple, vertical, and then a horizontal one below the breast. The most common scar that is done for most women is called as a lollipop scar. So that is one scar around the nipple that is not very visible. There's a vertical scar going down below that is visible early on, but it fades with time and leaves a small mark. So this is what the most common scar type is. Number 4, doctor, along with my breasts, my areolas are also very, very large. Can they be made smaller? The answer is yes. When we do the surgery, we try to give a smaller areola as well, along with smaller breasts, so that they are in sync with each other. Number 5, doctor, can I breastfeed if I get this surgery done? Well, the short answer is yes. The long answer is a little more complicated. Now, during a breast reduction, we do not remove all of the breast. We leave behind some part of it, and that part will be enough for you to breastfeed. However, if you do not have children, then very large breasted women by nature are sometimes not able to produce enough milk. So you might not be able to breastfeed properly, but that is not because of the surgery. That is because of the underlying hormonal condition of your breasts, wherein some women just aren't able to produce enough breast milk. But the amount of tissue that we leave behind should be enough to produce breast milk. Number 6, doctor, after the surgery, will my breasts feel the same? Will the sensation feel the same? Here again, the answer is mostly yes. In 70% of patients, the sensation comes back completely to normal. In around 30% of patients, the nipple sensation reduces a little bit and does not come back to what it was. The chance of this is more the bigger your breasts are. The more reduction we have to do, there's more chance that some amount of sensation might go away. But it's not going to go away completely. And like I said, most women get their sensation back completely. Number 7, doctor, is this surgery safe? This is a very, very safe surgery. It is done either as an outpatient where you go home the same day, or we might keep you one night in the hospital. Now, this is a very safe surgery, but it is a surgery, and in any surgery there are complications which can happen. The worst one is an infection. If an infection happens, that might require some management, some antibiotics. The chance of this happening is very, very low, but it is not zero. Think of it like if you're crossing the road, you might be hit by a car. It's something like that. You can never say that there is no chance of it happening. But it is a very, very safe surgery. The incidence of complications is around 0.05%. Number 8, doctor, can this surgery increase my chance of getting breast cancer? The answer is no. This surgery has no relation to breast cancer. Whether or not you get breast cancer depends on your genetics and your family condition and a lot of other factors. The surgery itself is not going to influence it in any way. Number 9, doctor, is there any other option that does not involve surgery? Unfortunately, the answer is no. In very large breasts, there is no way to reduce it without this surgical procedure. Liposuction is something that patients ask us about. It can be done for some patients, but is usually not a good idea because in liposuction, we're only removing the fat. We're not removing any skin. So if a breast is sagging, it will become even more saggy because you're emptying the contents of it. So it works for some patients, but most patients are not a good candidate for this. Breast reduction surgery is the only option. Number 10, doctor, even after this surgery, can this come back? Can my breast become very big again? Here the answer is no. It can only happen if there is some rare tumor in your body which is producing some hormones that might cause it to grow again. And this can be easily tested before the surgery to make sure that there is no chance of this happening. So these were the 10 most questions asked to me by women thinking of undergoing breast reduction. Overall, I can say that this is one of the most gratifying surgeries for me to perform as a surgeon. All my patients who undergo the surgery are very, very happy at the end of it, and they feel like their lives have gotten better. You can see some examples of such patients coming up. I hope you enjoyed this video. If you have any doubts or want to schedule an appointment, do get in touch with us. Thank you. Have a great day.